And welcome to our series of blogs, Conversations with Conversations About. We are introducing topics that are relevant to the local communities and colleagues that work on Leicestershire County Council as well. The aim is simple, is to bring closer to the public aspects of the work that we do, the impact that that work has on communities, and how the different communities interact with the services that we offer. Today we are in Hinckley, at Hinckley Library, and we're going to be talking to John, who is the local area coordinator, team leader for the area, and with Alan on my left, who is one of the, we'll say, beneficiaries of people who have been, a person who's been working with through the LAC, with the LAC over a period of time. He will explain a little bit more about that and what some of the benefits offered, how does it work, and so on. But first, John, if you can tell us a little bit more what the local area coordinators are, what the local coordination is, and what they do, that would be great.
Certainly. So, local area coordination in Leicestershire, and as local area coordinators, we're employed by Leicestershire County Council in Public Health. The local area coordinators, we all work in communities across Leicestershire to help improve the health, well-being and the resilience of the people who live there. So local area coordinators are based in the community that they serve, and we develop an understanding of what is strong. We look at what people, families and communities can offer each other and support them to help make each other stronger. We can show people how they can better connect to the community. We help people to find out what's happening in their area and to get the right help from the right services for them. The local area coordinator is here to help people. So it could be thinking about how to make their life better and look at what they have to offer. Connect people with others and to be part of their community. Find out what's happening in their area and get the right help for them. Take positive actions. We can also put people in touch with their local services or community groups. Work with people to help them achieve their goals and to lead a happier life. And we focus on what is strong in the community rather than what is wrong. We can act as community connectors, and we can help residents to use their passions in community to increase resilience and sustainable change. And as Alan, we're working with Alan, who's a coordinator for Barwell Befrienders, and Alan has been an absolute star in terms of providing, we work very closely with each other, it's a case of networking, and Alan will explain a lot more than I can about.
I'm a patient at Barwell and Hollycroft Surgery. I've been working with them for a number of years now, and I was charged with trying to find or to set up a befriending organisation, a telephone befriending service at the surgery, trying to deal with the issue of loneliness and vulnerability amongst some of the patients. As a member of the PPG, the Patient Participation Group, that enables us to work with the surgery on trying to improve things that the surgery offers. But having been charged with that issue of trying to develop a befriending service, where do you start? I had absolutely no idea. But I met up with Kerry Smith, who was then the local area coordinator for this area, and she began the job of advising me not only about how to get started, but also about how to find funding and direct me to organisations that might help, like Rural Community Council, Voluntary Action Leicestershire, and the Borough Council. Now, with that help, we were able to begin to develop what we've got now, which is a group of around about 30 volunteers who are looking after about 35 vulnerable people who have been identified by a health professional, like local area coordinators, who would benefit from having a telephone call once a week to just keep them in touch with society.
So would you say then, Alan, that the help would be just people understand in practical terms what it means? Is it, because you mentioned trying to find funding to organise, what was the funding for exactly?
Well, we need DBS checks. We
Right.
need to have our volunteers DBS check. But we also like to run activities
Right.
and things like that. And there are funds out there. but it's finding them, knowing where to actually apply and which are more applicable to us. Because unlike other charities, we're not a registered charity, we're too small. We're just a small group of people who want to try and make a difference. And a lot of funds require you to have been made into a charity, a proper charity.
So one of the things is then, rather than doing the funding for you, is helping you to find the sources of funding which are more suitable to what you want to do.
Absolutely.
And for what you said and for what John was explaining on the roles of the LAGs or local area coordinators, what would you say is the other big thing where local area coordinators help and support you, but also the communities that apart from the potential coordination or support you to find the appropriate source of funding, what would you say the big thing that it does make that difference?
Well, the thing that really makes a difference for us now is that the fact that we need to identify people who are in need from the sort of service we offer. And the local area coordinators are cast as health professionals. They're working with GP surgeries and other health professionals to target individuals who may need help. So we only accept people within our telephone befriending service who have been identified by a professional as in need or benefiting from what we're trying to do. Okay. So it's a way of getting people to engage as vulnerable people with what we can offer.
Okay, so that's quite comprehensive, it's quite understanding. So I can see in terms of summary, one is the support to find, as I said, the appropriate source of funding for the type of work that is required. The second one, which is an interesting one, is trying to find and perhaps coordinate, if I understood correctly, the connections that already exist in that community. Very much what John was mentioning about making strong something that already exists and work with those ones. So what would be then, do you think, what difference have you seen in the community, at least with the community that you're working with? What is the main difference that you have seen, improvement?
Yeah, I think that one of the main things is our aim is not to be constantly befriending people. We're wanting people to re-engage with society, having had COVID and all the other issues that have crept upon us. Many people are still suffering the consequences of things like COVID. And what the LACs have been able to do is to provide us with tools of enabling us to signpost people to support services that they can take on themselves. Right. Our job is not to constantly be a befriender. We see success when we begin to step back and enable that person then to take responsibility and care of themselves within the confines of where they're living or who they're living with. Because sometimes there are underlying issues which we call us amateurs, if you like, as just telephone befrienders. We don't have that professional background knowledge to be able to underpin what is really the problem. Loneliness is a symptom sometimes of some other issue, and that's where the LACs, the health professionals, can step in and analyse that much more and make our job more effective by giving us some sort of guidance as to how we might be able to develop that.
Well, thank you very much, and I think you have answered the questions I had for you, and you have expanded also interesting in what the community can expect from that. If I can ask you just a final thing, actually, from you, what will be your next steps? What do you think you're going to be doing?
We are always looking at ways of further developing things. The telephone is a brilliant communicator. Face-to-face, though, is the magic element, which, is the most effective. But for some people, it's not feasible, they're housebound or whatever, and therefore we, as telephone befrienders, are looking for ways in which we can develop things for them to be part of. That might be looking at transport, trying to get people to activities. We run a Christmas lunch, for example, getting people to those sort of things so that people can begin to re-engage face-to-face after that telephone consultation and meeting.
Thank you very much. Thank you very much, Alan, and thank you very much, John.
Well,
That was great. Thanks both. Take care.